The Global Pulse.
Welcome, everybody, to the Global Pulse, a podcast by Students for Global Health, where we monitor global health trends one beat at a time. We are back with our World Health Summit special episode. I'm your host, Edna, and I am with
Any?
Perfect. Welcome back, everyone. So
Yeah.
let's get into World Health Summit stuff. Eni, what are you consuming this week?
So I am currently consuming a lot of my module content for my master's. So that has been a lot. I am currently reading about kind of whether we should privatize healthcare and how the notion about privatization equaling better health outcome might not be as simple as kind of economists think it is, because healthcare is not simple, and kind of the advantages, the disadvantages. And it's just been interesting because I'm not a person who really cared about the economy or kind of anything about free markets and all this stuff. And it's like, damn, this is really important. This affects me. And it's like, oh, but it's been really interesting. It's been hard to like wrap my head around because it's just like if you do this, it affects this, you have to consider this. Yeah, but it's been interesting. That's what I've been consuming.
Fantastic.
How about you?
So I've been actually re-consuming. So I've read this book. Well, I didn't read it, I listened to it, an audiobook called Sick Society by um Professor Dr. Andy Knox. I called him professor. I don't know if he is a professor, but I actually did my elective with him last
No.
this summer. And he's a GP, but he's also now transitioned into a medical director role up north. And his book is all about how society is sick, both physically and metaphorically. He talks about what's wrong with healthcare systems within society, so healthcare inequalities,
Mm.
racial disparities, community issues within the communities, within the economy. And he gives sort of pragmatic steps as to how to sort of heal heal society so that we could all feel better as well. It's a fantastic read, and so that's why I'm reading it again. I also think because it's sort of linking up with the stuff I'm doing in my master's at the moment. So yeah, that is what I'm consuming. I would highly recommend. I'm lazy, so I always get the audiobook so I can listen to it like a podcast. But yeah, definitely would recommend. Today's episode, as we've mentioned before, is all about the World Health Summit. So I'm gonna ask you, Annie, since you've just come back from the World Health Summit, could you briefly explain what the World Health Summit is for people who don't know, and the theme for this year?
Yes, I can. So, if you are kind of brand new into the space of global health, the World Health Summit is this annual event that takes place in Berlin, and it brings together different players within the global health field, some health ministers, finance ministers, just anyone that basically has a say within the health of the world. And kind of to drive the direction of conversation, they choose a topic, and this year's topic was taking responsibility for health in a fragmented world, and basically the different, like what each players have to say about that theme. And it was a very, very interesting summit in terms of the conversations that were happening, the people that were there, and it was just because some of these people that you see when you're at the summit, you read about them, it's like,
Mm.
I'm having a conversation with you. I've read your papers, and it's like, oh, this is so crazy. And like, people are just talking to health ministers. It's like, everyone's just networking, phones are out, QR codes are out. Yeah, it was very, very busy. Everyone was speaking. I think by the end, everyone had lost their voice because it was just constant, constant speaking.
Yeah.
But it was so good. And they had different topics on like AI, women's health, children's health, kind of the like financing healthcare systems. And it was just interesting to see how it all plays out. Because when you're a student, you just read all these theories and like, how does this work? But you're confronted with the people who are actually making these decisions, and it's like, okay, like I kind of have a bone to pick with you, but it's like respectfully, I'm not because I'm a student and I just started. But it was so interesting, and I think it was really good that we went as a delegation. So it was about 14 of us within SFGH, kind of within members, NC, and our trustee board members. And yeah, it was nice to do it together, and it was a good experience. I would definitely recommend going if you get the chance to, because one of the things that we all became aware of was how inaccessible going to the World Health Summit is for some. I think student ticket prices are around 230 euros, and that doesn't include flights, accommodation, and like if you're thinking about if you're a student, like 230 euros, you don't just have that kind of money lying around unless you're rich. But in that case, go ahead.
Yeah.
But it kind of just, first of all, that first barrier preventing the people who are often on the ground
Yeah.
from engaging in discussions with the people who are making changes. And I'm pretty sure some of the discussions that happened at the summit, they will go on to kind of affect the policies that are made, the conversations, direction of conversations, things are happening. So if, first of all, you can't get into the room,
Yeah.
there's already this like exclusion of a number of people who are involved. And the summit do try and ensure that they bring people who are kind of unrepresented. So I think they have a stipend where they sponsor about 14 students from low and middle income countries to come, but still, like 14 people out of hundreds of countries in the world, that's not very representative. But I would definitely recommend going. If you can't go in person, they kind of host all their sessions online. So if you're interested, you can even look back and watch some of the sessions that they did. So that's the World Health Summit in
Fantastic.
a
It
short couple of words.
sounds amazing. Really triggering my FOMO here. But
Maybe next year.
yeah, next year I will be there. But during this podcast episode, we'll also be inserting clips from Professor Rosebella, who was at the World Health Summit. She has kindly given us some food for thought. So we'll be inserting clips. And our first clip is an introduction of Professor Rosebella and what she does. So yeah, enjoy this clip.
Hi, my name is Rosebella Alungata Iseme-Ondiek. I am an assistant professor and clinical epidemiologist in the Department of Population Health in Aga Khan University, based in Nairobi, Kenya. I undertake research on food systems, dietary behavior, nutrition, and related NCDs. I also teach undergraduate and postgraduate medical education students. And I run a surveillance platform in the coast of Kenya, Kilifi County, where we track a population of about 103,000 people annually, measuring over 40 indicators, looking at health, access to wash parameters, socioeconomic status, SRHR, a variety of health indicators that inform both health and development in that county.
This actually feels like a little bit like an In the Hot Seat episode, but Eni's in the hot seat.
It does.
But I have another question for you, which is what does it mean to take responsibility in this sphere of when it comes to regards to like global health?
Mhm. I think when I hear the word like responsibility, I often think of this image of kind of us having a load to carry. And if that load is basically left to one group of people or the healthcare system to carry, it's too much for them to carry. And other people have to come in, whether that's finance ministers, economists, and the people who are planning what our like urban areas look like. Everyone has to help carry this load because it's too much for one person or one group of people to carry. So I think taking responsibility means this is this is us. We're all living on planet Earth. Like whether you like it or not, you're gonna need the healthcare system at one point in your life. So you have to be invested. And kind of one of the things that we've been discussing in one of my modules is how healthcare systems are financed. And so often governments have a high proportion of their budgets allocated to like the military and a lower proportion to healthcare. And one of the kind of thoughts that I had was like, how are you not investing in your healthcare? Because
Yeah.
you're putting so much money into the military. Okay, I get you need to protect your nation, but if you have a weak healthcare system, and when you do, if it comes around, like are engaged in war with another country, if your healthcare system is like crippled, how are you going to take care of your wounded? How are you going to like recuperate your resources so that you can start building together? So I think it's like health is very important, and I think COVID showed us how much health is important. Like countries who didn't have the basics, the primary care basics in place, they suffered so much. And I think COVID should have been a lesson. I think countries are still trying to learn, but I think when we experience stuff, we should learn the lesson. And I don't think it should take another COVID for us to realize that health is very important and everyone has to play a part, not just people within like health in general.
I
But
completely agree.
that's my 2 pence.
Yeah, I agree. We recently had a sort of seminar by Professor Chris Whitty, who was talking all about the sort of like positive ways that we've that health has developed over the years, because we know that health is always like doom and gloom. Usually in the headlines, it's always like, oh, health this, health that. And he sort of put into perspective that, we are growing positively, but he did mention that he doesn't really think that we've really learned from COVID in the way that we should have learned from it.
Mhm.
So I guess for me, taking responsibility would mean um, is learning from past mistakes, um, whether it's to do with healthcare infrastructure, whether it's to do with access to health services, whether it's to do with complex interventions and how they're built and how the systems are built and who they're built for. It's all about learning from the mistakes that you've made, especially once you've realized that you've made them. Um, it sounds like it's like a direct, like, yeah, this is the way. I suppose in reality it's a bit more complex. I don't really know
Yeah.
what people are doing behind the scenes. So yeah, I think that's definitely what it means to me. I agree with you entirely. Um, and this is what Professor Rosebella had to say about that.
So, what does taking responsibility for health mean to me, right? For me, it's really a call to action. It's for us to understand that health is something that we're all striving for. It's something that we all need in order to be able to live a fulfilled life. So it's a personal issue, it's a collective issue, and it's also a political issue. And these are some sentiments that have been highlighted throughout the last 3 days. People need to be empowered to make informed choices, but they also need to demand an environment and a system that supports care, health, and well-being. And they need an enabling environment as well, and that's where policy comes in. And People need to recognize that the decisions that we make don't just impact ourselves; they impact also the people around us, and that's where it comes in as a collective issue. And we saw this with COVID. The importance of collaboration across countries, across sectors, because the decisions in one area influence health outcomes in another. So it's really highlighting the fact that personally, collectively, politically, we need to recognize that health is a responsibility for all of us. And the sooner we do that, the earlier and the better able we will be to attain health outcomes for all.
You might be wondering why Students for Global Health was the World Health Summit. And I just want to sort of start off this conversation by saying I think that the voices of the youth are very important when it comes to healthcare, when it comes to global health, purely because we are, that sounds so cringe. I was gonna say we're the future, but it's true. Like
Yeah.
we are,
Yes.
we literally are.
Yes.
And I think it's really important for us to have a say in sort of what goes on, because the decisions that are made now are going to affect us in about 20 odd, like 20, 30, 40, 50 years. Whereas sometimes the people who are making the decisions won't be around to see the actual full effects of their decisions once
Yeah.
they're of age. But yeah, what do you think, Annie?
I definitely agree. And I think some of the changes that are being made now, we're currently seeing the effects as well. And the fact that we are kind of seeing the effects, that should kind of prompt them to involve us. Because if it's happening to us, we know how it's happening to us and we want to do something about it. And I'm so glad like organizations such as Stop AIDS, which was an organization that kind of sponsored SFGH to go, are kind of saying we are invested in the youth and we want your kind of input in there. And it was so nice. When I say youth involvement is so important because one of the things I like about global health is the diverse like dialogues that happen just because people are just from different disciplines. So we were making this Instagram reel for Stop AIDS about digital health and kind of youth views about digital health. And one of the most, I think this was probably my favorite part about the summit was after we kind of wrapped up the videos, just the different conversations that were breaking out with like, I didn't realize you thought about that. And it was just like, these are, this is what it's supposed to be like. Like we're supposed to start these conversations and these conversations are supposed to spread into friends, into families, so people are more informed and educated. And like, who knows like what those students who did the videos with us went back home and spoke to their friends about, like, who knows, but the fact that they were asked to be involved and, oh, what do you think about this, and they had different perspective. The perspective that I brought was a black student, Nigerian, and has lived in the UK. That's very different from a Nigerian who has lived in Nigeria for the whole of their life. And just because we're Nigerian doesn't mean like we're gonna have the same beliefs. Some of the statements I agreed with, they disagreed with completely because like we are suffering back home. Like healthcare is not good. You guys need to stop complaining about the NHS. At least you're not gonna be like bankrupt after going. But it was just, I think that is one of the most important like things of why you should be there because we have a voice and we have the mode through like TikTok and just like advocacy and campaigning, we have the mode to amplify our voices. And if the governments are saying, oh, we don't know what to do, like we are the masses, we know what to do. Like tell us what to do and we'll not don't tell us what to do, but just involve us. So I think that's why youth representation is important because we have a voice and we actually have things to say. Yeah.
Completely agree. And I think the perspective of the youth being missed out is really detrimental, especially in this day and age, because quite frankly, social media, the power of social media is insane.
Honestly.
And I think that who better to talk about social media, to talk about digital health, than the people who use it and consume it the most.
Yeah.
And not just to do with social media, but also like ill health affects everybody. So it's not just elderly people who get sick, it's
Yeah.
people who are our age, it's people who are younger, it's people who are middle-aged. I think
Yeah.
that including all of these people in these conversations is important, especially when building like healthcare interventions or building policies that surround these different sort of diseases or issues, purely because I think when systems are built without the input of the people that it actually affects, it's
Mm.
often just it's just usually like it doesn't really work.
Mm.
It's not tailored, it's not co-produced. And I think the best systems, I think the best sort of healthcare interventions or complex interventions are the ones that are co-produced through
Mm.
participatory
Mm.
research and
Yeah.
engaging youths and like focus group, engaging older people in interviews, engaging all of the people that are affected by this issue
Mm.
in the actual sort of making of the things that fix the issue.
Yeah.
I think it's important to it's about diversity, isn't it? It's not just about
Mm.
diversity and where people come from. It's not just about diversity in gender, it's also about diversity in age.
Yeah.
I think that's really important. So yeah, we think youth voices should be heard loud and clear in this sphere. And we'd love to hear what everyone else thinks. So like if you had any sort of input, drop us a comment. We'd love to
Yeah.
see what you guys think in terms of what your perspective is with youth voices being involved in global health, because I know sometimes it's a bit of a polarizing issue.
We also kind of caught up. Professor Rosabella is going to give some thoughts because I know at the start, when you're starting your journey in global health, you can think, like, what am I going to like give? Global health is this massive, massive pond, and like I have a tiny stone. It's
Yeah.
unlikely to make a difference. And I think one of the things that came across in the interview with her was the fact that we have to start somewhere and how like we have a say. So listen to what she had to say.
Advice that I would give for young people, youth starting their global health journey is consistency and curiosity is so important, and learning is lifelong. Like you sometimes start off at a place where you feel like you're so behind and there's so much that you still have to learn and to achieve, but everybody is at that stage, even those who are senior to you. There's things that we don't understand, that we don't know, and we continue allowing ourselves to be teachable and to learn and staying curious, because it's only through that process that you're really able to make a contribution. And I think never underestimate the power of consistency. Every little thing that you do, adds up in the end, whether it's within your little community, your family. It adds up, and it gives back to the community, and at the end makes a contribution towards some of the outcomes that we're trying to attain down the road. And I think also ensuring that you're always grounded in the needs of the community, because a lot of the times we see a lot of emphasis in terms of strengthening healthcare systems and facilities and institutions, but our lives are lived in the community. That is where life happens. So really staying grounded in the community, understanding the needs of people within the community, and recognizing how you can contribute to improving that is really important.
For many people who go to conferences, when you're there, it can feel like, yes, I can change the world, I can do everything because everyone's there and everyone's talking about it. But when everyone goes home and like post-conference, it's like, oh, where's all that passion and fire? Um, so I think it's really important to keep ourselves accountable and the people who are like going to these conferences. So if your health minister went to like the World Health Summit, like as a youth, you should like make them accountable. Like what are you going there for? Like what have you promised there that you are going to deliver back home? And who's going to keep you accountable in delivering those promises? And just stopping the energy from dying down, because it can be hard because when you're at the conference, everyone cares about health. So it's like everyone wants to make a change. But when you go back to your home countries where people are, there's so much poverty, there's so much, people are just stressed, people are busy, life is happening. It's like, where was this energy? I think it's really important to, in a sustainable way, maintain that energy. And that could look um completely different for different people. So within like the youth context, it could be keeping in touch with the youths that you connected with, whether that's through social media. If you've got a post coming up and you kind of had a conversation with someone and they were very interested in it, like send it to them. If you are doing a piece of research and you want someone to like read over it, there'll be a nice perspective to add. So I think just ensuring that we're not just talking, but that talk is leading to action. And one of the questions I kind of asked Professor Rosebella was like, what is she going to do when she goes back home? Because she has to, not that she's the only one that has to do something, but I think it's not just about like showing up.
Yeah, it's
Like
continuing it
it's
on.
not, yeah, about going back and learn, like taking what you've learned back. Because for some of the youth and for some of the people who went there, like they were the only people from their country that was represented there, and just bringing back what you learned back to those countries. So who knows, like the next time you go to the World Health Summit, there might be 10 people from your country, because because of what you said, because of the actions that you brought back to your country. So, do you want to add anything before we hand over to Professor Rosebella?
Do you know what? No, I think you summarized it quite well. So yeah, here's Professor Rosebella.
One practical thing that I would like to implement when I go back home, believe it or not, public speaking is not something I'm fully comfortable with. It's always taken a little bit of talking to myself in the background before I'm able to do it. But something that I really appreciated over the last 3 days is the importance of storytelling. And even before that, there's so much learning that happened for me in my life, listening to my mother, my aunties, my siblings, my spouse. So we come obviously as Africans from a background where storytelling has always been part of our culture, and it perhaps is disappearing a little bit. But when people share their experiences, share the lessons learned, there's so much learning that happens for those around us, for the next generation as well. So I would like to be able to do more of that, whether it's in writing or in video form or audio form. Because it's a benefit for all of us when we share what we experience and what we learn.
As we wrap up today's episode, we wanted to talk about sort of what we would like to see, reflections based off of the World Health Summit, but also conferences in general, forums in general, and what we'd like to see going forward. So, honestly, I think the inclusion of youth is like it's up there with a top priority for me anyway. I don't know about the conferences, but for me, um the inclusion of youth, the inclusion of youth voices, and being able to uplift youth to care, really. I think that's what it is about. I think when people see other people their age caring about something, they're more inclined to care about it as well.
Yeah.
And I think that we need that in the healthcare sphere because otherwise, systems that used to be for the purpose of benevolence and helping people um, become a bit more sort of selfish and a bit less about helping the masses, a bit less about making sure that everybody has equitable access to things and more about sort of profits and bottom lines. And I think it's really important for us as the youth to sort of share the perspective of, okay, cool, we care and we want to make a difference, we care and we want to make a change, and we don't want things to remain the same as they have been for the past, however long, whatever the issue might be. So I think, yeah, that's my main takeaway, that's my main reflection. I think it's kind of like a call to action. So if you're listening to this and you have any sort of, even if it's just a little bit of like passion or inkling for anything healthcare related, I think it's really important what you have, what you've been feeling, what you've been researching, what you've been looking into. And I think it's really important that your voices are to be heard. So to take up opportunities as they come. I know can be it can be a bit sort of scary. Actually, Eni, I wanted to ask you a little bit like about imposter syndrome, like whilst you were there. Did you feel like sort of, oh my God, what am I doing here? Because I think that's sometimes what holds a lot of the youth back. So what did you think about that when you were there?
I think even before I got there, I was like going through the sessions and some of the topics I was gonna discuss. And in my head, I'm thinking, I haven't covered this
Mm,
yet. I don't know anything about it. But I think once you're there, like the conversations that happen, people are not necessarily looking for the the jargon and like technical knowledge. They're just looking at, do you have lived experience? Like, what is your, like, you're a human being. You've gone to a hospital and there's long waiting lines, regardless of if you're the director of this or a student of this, you have encountered the healthcare system. And that, like, in itself has so much value because, like, you, your experience, other people might share it. And sometimes it's often good that you're not the most knowledgeable person there because you can learn. I learned so much, like when I was there, kind of topics that we haven't even touched
yeah.
in my kind of degree. So I think it is there, but I think you also have to push yourself and challenge yourself and show up because like when you do have that question, there's no such thing as a silly question. Like some of these people have been doing this for years, and some of the statements that come out of a youth, it's like, whoa, this is revolutionary. But
Yes.
I just had a question. But I think just showing up and like owning the space and like owning your perspective because as a youth you can try and I need to sound smarter, but you're a youth. You're a youth. Like you're not there yet. So yeah, just show up. That
Mm,
was that's what I would say.
yeah.
Um
And I think in these scenarios, it's good to remember that nobody in that room knows everything. There's always a fresh perspective that you can bring. There's always something that you could say, like you were saying, that they would have been like, "Oh, I've never even thought of things that way." Literally, nobody in any room knows everything. So yeah, that's what I tell myself anyway when I'm going to places. I'm like, I feel like I shouldn't be here. But yeah, aside from that, any other reflections, takeaways?
it's kind of similar to what you mentioned, but the accessibility of some of these conferences. So with most of the conferences, they're often held in like countries in the global north, and countries or citizens within the global south often need visas, and just the cost itself of coming to the conferences or just ticket hotels, it's often like so inaccessible. As I kind of mentioned at the start, some people aren't even allowed to be in the room just because of that. So I think more consideration needs to be had or thought of, like where are we having these discussions. And I know, like the World Health Summit, for example, next year for their regional meeting, they're holding that in Kenya, which is a kind of okay. But still, there is that hurdle of like, how am I going to get there? The flights and students who want to be involved, like tickets are not cheap. And like considering hybrid joining and not just allowing us to just watch it, but how we going to get our questions asked. Like if I'm sitting at home in London and the regional meetings happening in Kenya, I want my question to be answered. Like how are they going to facilitate that? So I guess my call to action would be for anyone who's kind of in that position of power where they decide this is where we're going to have those conversations and this is how we're going to have this conversation. Just consider how the people we want to have in those conversations are going to get to that room in the first place.
Yeah.
Because I think that's accessibility is so important.
Yeah. And I think in that sort of vein, it's really more about equity. I think that it would make more sense for the sort of summits to be held maybe closer to the global south where people might not be able to join sort of online so freely. Um
Yeah.
Sort of because I know when I go to Ghana, the electricity and I
Oh,
don't get a lot.
stable.
They don't
And like
get
even have to buy data, even stuff
that
like that for students. It's
exactly.
like you're in school, you have like stuff you have to pay for, and you just because you want to get involved, you have to decide whether, oh, I want to join this or use my data for other purposes.
It's very interesting. I think it's been very interesting discussion. And yeah, so that is the end of our episode today. We hope that you've enjoyed sort of our discussion. If you have anything to add, we would love to see your comments. And if you'd like to get involved in opportunities such as going to the Wealth Hub Summit, because it wasn't just members of our national committee who went, there were also members from branches, am I right?
Yeah.
Yeah.
Got
So
it.
anyone within Students for Global Health that's sort of given these kind of opportunities, all you have to do is sign up. And yeah, so if you would like to get involved, like, comment, follow, subscribe, all of the things. And also don't hesitate to sort of contact us via our Instagram. We'll put you in touch with the regular teams, regular, I can't speak today.
It's fine. It's been a
Teams.
long day.
I know it's been such a long day. The relevant teams to get you involved. Yeah, we hope you've enjoyed the episode. Thank you so much for listening.
Time.
I've been your host, Edna.
Any?
And we will see you for the next episode of the Global Pulse. Bye.
Hey.
Bye.
The Global Pulse.